Hello everyone. Today, we're exploring the world of a medication called Sertraline, more commonly known by its brand name, Zoloft. As always, our discussions are for educational purposes. For health-related questions or concerns, it's essential to consult a medical professional. Sertraline, widely recognized by its brand name Zoloft, is an oral tablet that belongs to a class of drugs known as selective serotonin reuptake inhibitors, SSRIs. Its primary function is to affect the chemicals in the brain that may become unbalanced, leading to depression, panic, anxiety, or obsessive-compulsive symptoms. Zoloft is FDA approved and is primarily prescribed to treat depression, obsessive-compulsive disorder, panic disorder, anxiety disorders, post-traumatic stress disorder, PTSD, and premenstrual dysphoric disorder, PMDD. By helping to restore the balance of serotonin in the brain, Zoloft can improve mood, sleep, appetite, and energy levels, and decrease nervousness. Zoloft comes with its set of precautions. It's essential to be aware that taking an SSRI antidepressant during pregnancy may cause serious lung problems or other complications in the baby. However, you may also have a relapse of depression if you stop taking your antidepressant during pregnancy. If you are pregnant, your name may be listed on a pregnancy registry to track the effects of sertraline on the baby. It's also worth noting that young people who take Zoloft may have an increased risk of suicidal thoughts or actions, especially during the first few months of treatment or when the dose is changed. Before starting Zoloft, several factors need consideration. It's crucial to inform your healthcare provider if you're allergic to sertraline or any other medications. If you have a history of drug abuse, suicidal thoughts, liver or kidney disease, seizures, or bleeding problems, it's essential to discuss potential risks and benefits with your doctor. If you're pregnant, planning a pregnancy, or breastfeeding, consulting with your healthcare provider is vital. It's also important to inform your doctor if you have ever had heart problems, bipolar disorder, or a history of drug abuse or suicidal thoughts. All medications can have side effects, and Zoloft is no exception. Some individuals might experience sleep problems, dizziness, tired feeling, mild nausea, upset stomach, or dry mouth. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. More severe side effects can include serotonin syndrome, which is characterized by symptoms like agitation, hallucinations, rapid heartbeat, fever, muscle stiffness, and loss of coordination. If you notice any of these symptoms, seek medical attention immediately. Zoloft might interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Especially, avoid taking MAO inhibitors, pymazide, or disulfiram with Zoloft. Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Zoloft. The dosage can vary based on the condition being treated and individual patient needs. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. While on Zoloft, it's advisable to avoid alcohol as it can increase the risk of side effects. It's also recommended to avoid driving or operating heavy machinery until you know how the medication affects you, as it can impair your thinking or reactions. Many wonder about the age restrictions for Zoloft. It's important to note that Zoloft is not approved for use by anyone younger than 18 years old, except for cases of obsessive-compulsive disorder in children and teenagers. Always consult with a healthcare provider for any specific queries related to this medication. That concludes our overview of Zoloft. Remember, this information is intended to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.